The European Union-funded Global Climate Change Alliance Pacific Small Island States project is being implemented by the government of Kiribati with assistance from the Secretariat of the Pacific Community, SPC. The project is increasing the Ministry of Health and Medical Services' capacity to engage in environmental health surveillance and response. A new laboratory, equipment and training is being provided to the Environmental Health Unit so that they can better monitor and respond to vector-borne diseases such as dengue fever and other health impacts that are sensitive to climate. These include changes to drinking water quality and the incidence of food poisoning, especially ciguatera or fish poisoning.
This lab is opened in 2014 and is funded by the EU through its GCCA, Pacific Small Island States project. And as you can see, all the equipments here are funded by that project as well. And it's improved a lot of our work in the water monitoring and surveillance. What we do here is the physical testing, like the pH, salinity, and also the suspended solid, chlorophyll, and there are also samples that we process for chemical analysis that we send to Niue in New Zealand.
Water monitoring program. We use the vehicle twice a week for water collection and sample, and that's mostly Tuesdays and Wednesdays.
We are now about to collect our samples to be tested in the lab. These are the samples that we have to be processed back in the lab. So we put in a full bin. And this one is for the physical testing.
TTM trainings, I think that's been very useful for not for only the environmental health, but for the public health division. Also for the hospital at large, because we are developing maybe future epidemiologists there. Now, for example, their information system, they're sharing whatever they get in their system. They have a template we developed during the training, and now we are sharing all the weekly updates to all concerned partners, including all 8 of departments in the ministry. We should have a clear guideline. I think Kiribati is one of the countries without any guideline. We develop our action plans from past action plans. Now, with the NEAP, or the National Environmental Health Action Plan, we have a clear role, like we target things that we should do each year. And that's the importance of the NEAP, so that we can do our work more strategically.
Kiribati is also revising its public health ordinance to protect the health of its people. This was prioritized under the Kiribati Joint Implementation Plan for Climate Change and Disaster Risk Management.
In Kiribati, it's quite difficult for the population to have access to, I guess, safe drinking water. We have a centralized water system in Kiribati, which reaches all households on South Tarawa, but then there are also informal households which do not have access to water. And again, there's the problem of contamination from the sources and the pipings that have leakages in them, this also creates a problem for the population, especially to the children who will also be drinking the water. The SODIS is part of the Strategic Health Communications campaign that's currently rolling out in Kiribati, especially with the GCCA PSIS project. What SODIS is solar disinfection, so exposing water under the sunlight for a time span of 6 hours, letting the heat and the UV rays work together to disinfect and kill the bacteria that's inside the bottled water. This proves a less cost way for Kiribati people to decontaminate their water, to have safe drinking water that children of course can have as well. And this also addresses one of the problems with diarrhea that we constantly have in Kiribati. I think that's our target population. Our target audience would be the parents of under 5 years old, to provide safe drinking water for their children.
These and other activities are helping the public health sector respond effectively to the human health-related impacts of climate change and climate variability.